Hello,
Hello.
Assalamualaikum. Good evening. How are you guys? Walaikum assalam, walaikum assalam. How are you guys doing? Hmm?
All good, ma'am. All good.
Okay, that's great. That's great. So I can see many of you have joined in. Nazia, how are you doing? Jahan, Hindu, Hira, Farah, Dr. Nadeem, Bushra, Aisha, and Anna. So I hope you guys are doing well and preparing well as well. Now only few days left for your final exam, right? So today we are not going to practice so many things. We are just going to talk about that how you are going to utilize these days until you go for your exam. And secondly, we are going to talk about that the what strategies needs to adapt in all these the days. Okay. So we are going to talk about some of, in fact, the queries as well. If you guys have any, you guys can open your mic, you guys can write in the chat box, okay? So I will try to answer with the best of my knowledge, and of course, I will try to guide you as well, okay? So let's get started, guys. So first thing first, the first thing we need to learn about this exam is that how we are going to cope with our stress. I know I've been there, okay, and I've been through exams as well. Couple of exams, so many exams, in fact, okay. But this MRCOG Part 3 puts an a kind of the different level of stress in which, of course, we need a lot of effort to cope with. In fact, and we need a lot of you can say the advices or positive, the energy towards the end of our preparation and just before the exam. Okay. So definitely, that I will take your questions, your query. Okay. So whatever you guys want to say, want to ask, want to discuss anything, okay, just before your final exam. So I'm here and I'll be with you. And so first of all, let me talk about that. What should be the coping strategies in crucial and stressful last days? Okay. So what are going to be those, the crucial, the good strategies in this, the stressful time? So first thing first, you don't have to do so many things. Okay. So what you need not to do is that you don't have to study too much. Okay. You don't have to try any new thing in the end, because whatever has been done, and you can't undo anything in the last the crucial days. Of course, mind has a kind of capacity once the neurons get exhausted, so they cannot even they take any new thing in. Okay, and it's not even wise to touch whatever you haven't touched so far and you want to try it on now. Okay, so don't do that, and don't study too much, because you don't want to get tired before exam, isn't it? Because exam is going to be tired itself, because you are going to be in that mode for a couple of hours, and stress on top of stress and on top of exam, and running from the one room to the other room, and with just 2.5 minutes of waiting time. So of course it is going to be stressful. Okay, so just keep yourself calm, just keep yourself in a mode in which you are going to utilize your energy, you are going to utilize your neurons, you are going to utilize your the efforts, okay, effectively. So this is what you need to do, is that you don't need to try any new thing in the end of your preparation. You don't have to study too much, you have to relax a bit while you are practicing. I will tell you that in the last days, because this is the question which I get quite oftenly, that how many stations we do have to practice, and we are going to talk about that as well. Plus, don't try to speak in and sneak in into every free group there is, because what will happen is that in the end, in the last days, when you just need to save yourself, so what are you going to be doing is that you are going to end up in reading messages and listening to the audio. Nonetheless, it is like, I mean, kind of good, because everybody, I mean, whoever is giving you free teaching is giving you some kind of knowledge. But for you as an exam candidate, I think this is not a wise idea in this the last week, that you are going to the go through so many things, you are going to listen to so many audios, videos, and blah blah blah. Okay, so don't practice too much. This is going to be another the kind of sincere and the humble advice from my side as well, because if you are going to practice, you are going to speak, you are going to talk. So I mean, you might get sore throat, you might get and on top of weather is not good, on top of we are dealing with so many the viruses around. Okay, so just keep yourself relaxed, and in a way that you are the kind of conserving your energies. right? Because you have to face the big day. That is your, the big day in which you have to be prepared. Then how you are going to cope the stress? This is important, isn't it? So you just need to stay calm. Number one, you need to stay positive that I can do it. You don't need to overthink at all, because just now and half an hour ago I got a message that, ma'am, I just don't want to go for this exam at all. So remember, my dear all, that if you are going to postpone it today, or if you have the got the the seat, and you have paid the fee as well, you took the the stress as well, and now in the last moment if you are saying that I am not going to go for this exam, so I think this is another level what you can say, the kind of demotivation. Okay, so don't get demoralized by anything. Okay, don't overthink. Don't think that I have to be 100%. Nobody can be 100%. Okay, so you can just give your best. All right, you can just give your best, whichever you have learned so far, whichever you have practiced so far, whichever you have I can say that practiced with your the any respective mentor, or with your fellow colleagues as well. So don't just think that I have to be 100% and I have to be on top of everything. I need to memorize each and everything. And this is where what you are going to do is to yourself. You are going to stress yourself. You are just putting unnecessary burden on yourself, that you just have to do this. Plus, this is very important. Don't compare your preparation with anyone around, because everybody is different, right? Everybody has different strategy, everybody has different the way to study, to absorb things, to I must say that how he or she presents, how he or she speaks, behave, whatever. So you just need not to compare your preparation to anybody there is, because everybody is hailing different life. Everybody is going through, the different kind of, I can say the stress, or the hurdles, or this and that. So we can't compare ourselves with anyone. We shouldn't be doing that. We shouldn't be comparing our journey to anyone as well. Okay. And more so in the last week. So please don't compare this, with anyone, that, okay, that the girl with whom I'm practicing, she is much more capable than me, she is going to surely pass and I'm going to fail. Okay, so don't think you are inferior to anyone. You are equally capable of going the of the of being a good student, and you are equally competent to go for this exam as well. So you don't need to think at all that you are inferior to anyone. All right, so don't you ever think that I am going for exam just to pass it. Okay, so if you are going to fix your mind for only this, that no, I just have to pass, I just have to pass, trust me, you are putting another level of stress on yourself as well. Okay, so please, in the last the 1 week time, so don't put any kind of extra burden on yourself, on your neurons. Just try to stay calm as much as you can. Just try to to stay positive as much as you can. Don't fight with your siblings, don't fight with your the kids, or the family members as well, because this is also a kind of a natural phenomenon, that once we are stressed, of course we just want to vent out, we just want to the say, or the you can say. And I think the being angry is not going to solve anything. Okay, so just stay calm, and stay focused. So how you are going to utilize these last days, like I said earlier, that you don't need to read any new thing. Plus, don't stop practicing. Okay, or and just listening to the audios or videos, don't do that either. Okay, because you need to keep balance, between the both. And don't compromise your health, sleep, and appetite. Eat properly, sleep properly. Try to sleep at least 6 to 7 hours, straight if you can. Okay, and it's a good thing that you have to be prepared, because you have to be prepared for your the exam day. Practice must stations with timer. Okay, now it is high time when you have to time yourself, which you have been doing quite a lot. Okay, which you have been doing for last in a couple of months. So what you need to do is, in the end, you just need to the kind of see that where you stand now. Okay, I mean, can you utilize effectively your 2 minutes? Can you effectively utilize your 10 minutes or no? This is very much important, that how you have to do it. Plus, practice at least 5 to 7 stations in a day, not more than that. Okay, I got another message as well, that what if I practice 14 stations in a go in one day, which perhaps is not a good idea. Okay, because practicing 14 stations in a the exam, like I mean, maybe with any mentor, maybe, if you are taking any mock with somebody. So of course, that is going to be different. And that is going to be different with your fellow colleagues' study buddy as well. Okay, don't practice 14 stations in one day, because this is going to be really stressful. Okay, so practice 5 to 7 stations in a day, and I think it is good. So in the last 7 days, what you can do is that you can pick important modules first, which you think is lengthy. For example, antenatal care, maternal medicine, they overlap together, isn't it? So you can pick, the important must stations which you think are very much important. For example, breech is important. For example, Down syndrome is important. So certain anomalies are important. Learn how to do the breaking bad news. Okay, improvise yourself. Just the try to revise all these important things. Okay, like in terms of anomalies, bilateral telepathia is very much important. Anencephaly is important, right? Omphalocele gastroschisis is important. So at least these should be on your tips. Remember, if you don't, the common thing or the easy thing, trust me, you are not going to perform, I mean, well, even if you know so many, the difficult stations around or difficult topics around. All right. So try to rehearse, the must things in the end, in the last, because brain has another, the beautiful kind of, the capacity in terms of that brain restore the information. Okay, recent one, recent past, and the, the remote past as well. So everything is going to be recalled once you are going to be in your exam. Okay, so do try to, and remember, applied clinical knowledge is equally important. Don't just try to, the memorize things as well. Okay, that memorize stations, memorize lines. No. Just memorize or just practice that how you are going to start your station, how you are going to go about in 2 minutes time, how you are going to utilize your 10 minutes time. You just need to learn that. Okay, don't try to memorize, the lines. Don't try to memorize, the templates. This is such a bad idea. Okay, because you don't know how role player is going to behave in exam. Okay, because of course, the exam is exam. They can bring the same station, but perhaps they are going to change, the marking scheme. They are going to change the marking criteria. They are going to change, the couple of tasks in that, the particular station. So don't ever think that, exam is going to be exactly repeated. Okay, because of course, I mean, we do have, the important syllabus. We do have important, the topics which are kind of must to come in exam, isn't it? So we can't ignore those topics. So don't just assume that, okay, the same exam, is going to be repeated now, and I just have to memorize templates, and this is how I'm going to, crack this exam. In a way, I mean, it can be effective, but it cannot be, the 100% for you. Okay, because you have to be prepared for your exam. All right, so whatever has been done earlier, it has been done. It was for the previous candidate, it was for the other candidates who either have passed or either have flunked the exam. Okay, so make sure that you are preparing yourself in a way that how you are going to utilize your time, which is very much important. Okay, so please don't compromise on your health as well, plus sleep, appetite. Okay, so do try to sleep for, like, I mean, 5 to 6 hours straight if you can. Do try to have the healthy diet. Okay, water and the coffee, cola, whatever you want to, but just try to keep your yourself dehydrated. Just try to keep yourself the calm at all times, because if you are going to stress yourself physically, mentally, so trust me, by the end, by the time you have to go for your exam, you will be so tired. You will be so tired even to get up. You will be so tired even to go for that exam. Okay, so just try to keep yourself as much as relaxed as possible. So just before exam, one day, what you are going to do, I think it's going to be started on 6th, right? If I'm not wrong, from 6th of the February. So from the 5th is going to be Sunday. Okay, so I will advise you that don't study on Sunday at all. Okay, don't study too much, or don't practice. Stop practicing. If you really want to scan, so just scan the quickly whatever you want to, and just the stay calm. Just the rest your the vocal cords. And this is very much important. If you have any kind of the sore throat or something, so do try to keep yourself the healthy for that day. Okay, so the stop studying one day before exam. Stop practicing. Have a walk in the park, because the walk, or the simple, the kind of exercise does help as well. Spend time with your family, kids, or pets if you have. Take good sleep, have proper meal, but not heavy meal. Okay, it shouldn't be so heavy that the other day you are just like kind of it's going to be heavy on your stomach or what. Take again 5 to 6 hours sleep at night just before exam, so at least you are going to be fresh once you are going to be in your exam hall. So the on final exam, of course, don't panic. Okay, get up early, pray, exercise, meditate, whatever you want to do. Okay, don't go empty stomach. All right, don't go empty stomach in exam. Coffee, okay, tea, and don't revise anything. Don't you dare revise anything on the day of exam. All right, because it's not going to stay anyway, because like the exam stress is there, adrenaline rush is there. You already are going to be the kind of in a mode where where you can easily panic, right? So what you need to do is that the getting stressed means you are more likely to misread the question. So you don't need to misread the question at all, because those 2 minutes are going to be very crucial for you, that how you are going to to perform in the next 10 minutes task. So it is very much important. All right. Then the oscillator check. Of course, on the day of exam you are going to get this oscillator check, right? So you are going to get this, and you are going to. I'm sure you must be. Have you guys got the ID links? Okay, login details yet or no? I think no, right? Nobody has gotten it yet. Yeah, I know. So make sure that you are having your system in place. Okay, make sure you are having your the working laptop, working desktop in place properly, and the Google Chrome is installed. Okay, it is very much important. Plus, the before you check your system, do try to give permission to audio, to the video, to the access to the system. It is very much important, because recently I had the mock with one girl. So somehow her laptop was not working, and luckily it was like with me. So of course I had to tell her that you have to give permission to your laptop or computer to use the system, Osler system. Okay, so make sure that you yourself are ready, plus your internet is ready. Internet has to be so strong. All right, I'm sure you guys know that. Okay, so one internet, two internet, the spare internet should be in place, and it should be fast enough. Okay, and there shouldn't be any kind of the interruption. There shouldn't be any kind of weak signals or something. So make sure that when you are testing your device and when you are testing your system, so you are using the same internet in which you have to sit for your exam. Okay, and for exam day your room, it should be very quiet. Okay, there should not be any noise. There should not be the any kind of extra, you can say, the air or something which is going to the hamper your voice. Make sure you are having overhead the headphones, so it is not going to transmit the voices here and there. So this is a good idea. Don't use hands free. Okay, so it's not advisable. Use over the head the headphones, or the headphone which I am using at the moment. All right, so it is going to be good. With regard to your the dressing on the exam day, so make sure that you are in a formal attire. It should not be, for the girls, it should not be very flowery, it should not be very eye catchy. It should not be yellow, orange, okay, red, any bright color, because it will look bad. So use the soft colors. Okay, white, blue, black, they are the common the formal colors. Okay, or pink, or the peach if you want to, but it should be very light. Okay, don't wear any jewelry, don't wear any makeup, don't wear unnecessary ornaments. Okay, it looks so bad. Okay, it doesn't look professional. You have to look professional at all times. For the boys as well, again, don't go in your the jeans and t-shirt. Okay, because of course it's going to be online, but still it shouldn't be the t-shirt, or it should be like kind of wrinkled clothes or something. It should be very nicely pressed. Again, color should be the same, universal, black, blue, okay, white, and wear tie as well. For boys, it will look so good. Okay, so at all times you need to look the kind of professional. And for the girls who want to wear hijab, or who want to do the niqab as well, so make sure that you are not the kind of the changing it, and you are not the fixing it again and again. Okay, so it should be, everything should be ready before you the enter into your exam hall. It is very much advisable. Okay, because it will look so lousy if you are the checking your the dupatta, if you are checking your scarf, if you are checking your hijab or whatever. Okay, make sure that if you are even having, so it is properly tied, and it is properly there. So don't do unnecessary movements because you are going to be on camera online. So, the invigilators are going to be, watching you over. So, I mean, no unnecessary movements, no unnecessary drinking, eating, or doing, the body postures, the somewhat. So don't do anything. Okay. So for 3 hours, you have to look like, I must say, a kind of a robot that, who is performing the task accordingly and who is not doing unnecessary things. Okay. So I hope it is clear. And for the girls, one more thing, don't wear so much makeup. Okay. Like, the lip gloss is okay. And that's it. You don't need to, the look model, and you don't need to look anything. Okay. So again, let me tell you, yeah. So I mean, no, nothing like, I mean, kind of, it shouldn't be very, the kind of vibrant. Please don't use vibrant colors. Okay. Let me repeat again, no yellow, no orange, no, the dark pink, no red. Okay, please. And no hanging, the ornaments in ears and, the jewelry, blah, blah, blah. It doesn't look nice at all. Okay. And plus no nail paint. Okay. So for the girls and for the boys, yes, they should look decent. They should look, the professional as well. You are going for, the very good exam. Okay. Highly prestigious exam. So just assume that you are in, the face-to-face exam, and, you are being, the observed, and you are being watched over. Okay. So apart from that, the once you are going to be on the exam day, you are using your login details, right? So you are going to be given, the command to do the system check, and make sure that you have given permission to your, the laptop or the desktop if you're using, for the camera, for the audio, for the internet, and, the Wi-Fi as well. Okay. So then you are going to have, this kind of window in which it will be given that, hello, welcome to our Osler, the online. So this is, your video, this is your candidate, this is the date, and, the start time is going to be here. Okay. So make sure that you are well versed with this. Then you will be taken into a waiting room kind of thing. Okay. So before time, I think it takes almost 30 to 40 minutes before, the actual time. Okay. So you are going to be in waiting room. So in waiting room, make sure again you are waiting with very calm poise. In that, the situation, you can only pray, or you can only, sit calmly, just as, to calm your nerves down, and that's it. All right. So you are going to be there. Then your exam will start. Once your exam is going to be start, you don't have to leave your screen at all times. Remember, okay, until and unless you are facing a lot of problem, a lot of internet lag, a lot of, the thing in which you can't change your screen, then only you are going to log out. Otherwise, don't change your screen. Don't just try to, log out your system, because once you are going to be into the Osler system, you are going to be into that system. You don't have to do anything. The system would change the screen for you for 2 minutes, then for another 10 minutes. All right. So you don't need to go and again, the login and log out. It will take a lot of time, and you may miss your precious time. Make sure that you are, the running after, the even for 30 seconds, 40 seconds, the every second will count. And mark my words, this you are going to feel in your exam. Okay. So 2 minutes reading time, 2 minutes reading time should be very good. Then, the screen will change. You will get the 10 minutes, the performance time. On 10 minutes performance time, again, this is going to be like, I mean, you can, see me. All right. So similarly, you are going to be, the seen by the role player, by the examiner, and by the, the examiners who are, in the background, plus invigilators as well. On every, the candidate, you are going to be having, the invigilators, okay, from our COG technical team. So they are going to be with you all the time. If you are facing any kind of problem, so you are going to write in there, the chat box. So you will be having, the kind of, the windows. So these are going to be, the kind of window which you are going to see. So you are going to see yourself, okay, role player, examiner, or if at all there is lay examiner as well, then and in another window, lay examiner too. In the lower column, you will get whatever you want to write. Okay, so you can write if you really want to. Okay, but please stop. Don't make keys at that time. Just remember important things like age of the patient, name of the patient, and what is her basic complaint, and what is your task. This should be at all in your mind. Okay. So please don't start making keys and the writing tuck 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 tuck. So it will happen, it will give you stress, and of course it will be a little bit noisy as well. Okay. If you really want to write, otherwise you cannot, you can just the focus on the screen. You can just read your, the question. Then in another window, you will see question. Okay. And you can, there is going to be a cursor. You can scroll it up and down. So it's going to be easy. And here there is going to be the RCOG technical, the team kind of, the window. So if you are facing any kind of problem, you are going to write over there. You are going to, tell them that I'm facing this problem. I can't change my screen, or I can't hear the, the role player, or I can see the examiner. So this way or that way, the system is going to be very easy. It is going to be very easy to handle as well. All you need to do is you just need to enter into this system and don't leave it until you finish your exam. All right. So make sure that you are not even doing any kind of mistake, that you are leaving the system altogether, because entering in the system, because it's going to be heavy, because everybody will be on that system. So perhaps you will get, some kind of difficulty in that, the particular time. So don't do that. All right. Again, I will repeat the same. Check your internet, check your laptop, desktop, whatever you want to use. You don't need to use your MacBook. You don't need to use your mobile or, the iPad. Okay, anything. So it should be laptop or desktop. That's it. All right. Then what you are going to do in 2 minutes time, it is important. Yeah. So in 2 minutes time, you have to read your task carefully. You need to have a situational awareness. Trust me, when I was in exam, so I had a hard time in remembering the patient's names. And what happened was that, in initial 2 tasks, I had, the name. So I gave the same name to, the another, the candidate. So whatever it was, so I was like, so it's important. So don't just repeat the same. Whenever you realize that, okay, I'm, this is not the right name. This is not the correct name. So you can always go back. Okay, I'm so sorry. Then can I cross check your name and it please again? Okay. So make sure that you are not, doing this mistake. Noha, yes, as far as I know, you don't have to use, okay, just laptop and desktop along with your camera. Okay. So camera access is also very necessary. All right. So camera should be there, and if there is inbuilt camera, that is okay. Otherwise, you can have your webcam, anything. Okay. So read task carefully. Read task carefully. Make sure that where you are standing, where you are at the moment in this station. Yes, you are ST3. You are working in an infertility clinic along with your consultant, and at the moment your consultant is not here, but you are here to talk to the lady so and so and so. Okay. So this is going to be your situational awareness, that where are you at present and what your task is and what you have to do. In that scenario, whenever you see that, you are covering your ward and, or, the clinic, your consultant is not here, always, you apologize beforehand. You can, because it gives very, the good idea to the role player as well, that, okay, this doctor is, the fair enough, and, she is talking to me and she's telling me consultant is not here, and, she is here on her behalf. All right. So always take permission that I'm so sorry that my consultant is not here today. He's away for some, the work, or he's away for, the vacation or something, whatever. So, but I'm here to talk to you on his behalf. Would that be okay with you? Yes, doctor, it is. Okay. So naturally they will say yes, because they have to pass their 10 minutes and you have to spend your 10 minutes as well. Then it is very much important. Check what domains are being, tested in this task. Okay. So, for example, maybe, which is very unlikely, but maybe in some situation, there is not going to be any information gathering. Okay. If information gathering is not there, you are safe, because you don't have to talk much. You don't have to spend your 5 to 6 minutes time. It means then you have to utilize those 10 minutes time effectively for some other thing. So that you need to understand from your task, that what exactly your task is. All right. Domains, what are being tested, it is very much important. Nonetheless, the patient safety is going to be tested in every, the task, because that is mandatory. And, the communication, if at all it is simulated patient task, and patient safety is going to be there. Applied clinical knowledge, of course, it is going to be checked in the simulated patient task, as well as the structured discussions as well. Okay. Like I said earlier, don't start making keys, because you are going to be writing, it can make noises, plus you are going to be distracted as well. Rather just focus on screen and just, note it down in your mind that, okay, she is 30 years and her name is Elizabeth, and she's here to talk about this. So my task is, I have to break the news, I have to do the management, and don't read aloud again. Okay, this is just for your rehearsal. Okay. Right. And then, if you have make up your mind that how you're going to start your station, then, to stay calm. Once the screen will change, you will see the role player. Okay, then start. Okay, hello, I'm Dr. So-and-so, and I'm one of the doctor in the clinic today. So blah, blah, blah. This is how you are going to start. Okay, check that it is a referral letter from, the GP, from midwife. Because if it is a referral letter from the GP or the midwife, you have to send them back. You have to write them back. Okay, because that is going to be your communication with colleagues as well. Formulate how you are going to start your station, because somehow what happens is that it is not going to be a good transition from one station to the other station. Okay, we might be thinking about the previous station. Oh my god, whether I don't know, I forgot, I didn't ask the allergy, I didn't ask her, the age properly, I didn't ask this thing. So don't think about, the previous station. Don't take the baggage ahead. Whatever has been done. Okay. Those were for those 10 minutes. And then in this 10 minutes, you just have to be, embedded in the another role, and you have to talk to the woman, and then you just have to, the counsel, whatever your task is. Read question again and again. So not to miss any important information. Okay, maybe information gathering is not there, and you will start talking about information, the like we are used to, right? So I mean, make sure that you are reading question properly, because if you are not into that frame of mind, that what domains are tested, what is your task, so I'm afraid that you're not going to perform in your 10 minutes time. Okay, so clear everyone up till now? Okay. Right. So for 10 minutes time again, you have to look confident first of all. Okay. You need to start your station properly, calmly. Okay. Even if you don't know about anything about that station particularly, so just don't show it from your face that you don't know about anything. Okay. And it happens, of course. Like, I mean, we cannot be 100% in our preparation, and we cannot even memorize everything perfectly, right? So some few things are going to be, if at all, it is difficult for you, it is going to be difficult for the other candidates as well. All right. So pass marks can be accordingly, and roughly, this is for the last, the 4 years, it is static somewhere between 62 and 63. It is not more than that. Okay. So 62, 63% if it is there. So it means that, hardly you have to perform 9 to 10, the clear pass station, and or you can say that 8 to 9 clear pass station, then, the 4 to 5 borderlines, and it's better not to fail any station. But even if you think that, you haven't covered this station properly, so one is okay. So it means out of 13 station, you have to do, the very good in 8 to 9 stations. Okay. So this can only be achieved when you are in right frame of mind, when you are, the reading question properly, when you know what are the domains, what are the, what is your task. Only in that scenario you are going to perform. Yet again, let me tell you again, because some of the stations might be familiar, because these days we all are practicing. Okay, we all are the into the courses and this and that. So of course every teacher that gives you knowledge, every teacher gives you the time that how to perform, how to behave. So don't just assume that, okay, I have practiced this station at that place, so the role player said this, so now role player will ask this. Just wait what role player is going to ask you. Okay, don't assume anything. Don't assume anything. All right, and don't just the start your station on assumption that, okay, today she is here to discuss about this, because I have rehearsed this question with so and so, and it was this. Okay, so make sure that you look confident, you enter into the cubicle calmly, you familiarize yourself with the cubicle. This is important, right? Because now you are in the online exam, so of course you are going to see the screen. But when we were in face-to-face exam, so we used to have the people. Okay, if it is structured discussion task, so one the consultant and the other student. If it is role player, so one role player, one examiner, and one student. If there is another the lay examiner, so then there are going to be the couple of more the people in the cubicle. So likewise in the online exam as well. So don't just try to look at, don't just think of that, okay, if I have said something, so they are going to praise me, they are going to show me any signs. Trust me, they are going to be mask face until and unless the some the a role player or some, the consultants or examiners may show any kind of, you can say that, yes, okay, well done, okay. But somehow, all of them are going to be masked face, okay, no expressions. So don't expect that they are going to tell you hints that, okay, yes, you are going in right direction, okay, go on, or don't do that. All right, just focus on role player. Just listen to the role player, be an attentive listener. Attentive listening is a key, according to me, for this exam. If you're not listening to role player, if you just want to bombard her or him with your information, this is not going to do good anyway. All right. So listen to role player. Listen to the examiner. What exactly the question is. All right. Like I said, that don't assume. Don't assume. Even if you think that you have finished your station before time, before the screen changes, so don't exchange, the glances with anyone in the cubicle. Just stay calm, okay? Just stay calm and the sit like the way you are sitting, and that's it. Another thing I want to address is like that because we do the practice online, okay? Very few candidates they go for face to face any kind of the course or the preparatory thing. So make sure that you are showing everything from your the whatever is on the camera, okay? Your body posture, your face, your facial expressions, your shoulders, your style, okay? If you are talking to the role player, you can even lean forward, you can even they change your posture, you can even they use your hands movement, okay? So like we do in the real life as well, like when we are explaining something, so we do try to the move our hands, move and yes, leaning forward, okay, not like lying down on the the table or wherever you are sitting, but still it has to be shown from your complete body, the because how you are behaving to the role player. If it is a breaking bad news, so make sure that it is showing from your the whole the face, facial expressions, plus your tone, your pace, that yes, you are going to give any breaking bad. If you have to explain anything, always remember that inquire, give information in chunks, okay? Don't just start that, okay, I have to they just utter my whatever I have learned, whatever I have memorized, I just have to say it to the patient. No, after giving one information, inquire, am I clear so far? Do you want me to repeat anything? Okay, is that okay with you, that if I talk to you about this, and always remember, when you have choices in terms of medications, in terms of the management, always try to give that we have got a couple of the management options for you. So I'll be telling you one by one, and you can stop me in the middle, or you can even ask any question by the end of our consultation. Okay. So if you will say that yes, for example, we are dealing with the topic pregnancy. Okay, if we are dealing with miscarriage, if we are dealing with any where we have got a couple of options, expectant management, medical management, surgical management. So tell her that okay, this, I'm afraid that this is not going to be suitable option for you, although this is one of the treatment options. This is another option, but I'm afraid this is not going to be suitable for you. Okay, but don't just force her to go for particular treatment option, because just as a doctor we know that this is the good for her. End of the day, this is what she has to choose for herself. Okay, for example, the breach in labor, okay, undiagnosed breach in labor is there with you. So yes, we know it is primipara, and if it is undiagnosed breach in labor, so according to the guideline we have to go for cesarean section. All right, so but she is adamant for vaginal breech delivery. So you're not going to say no, breech delivery is not going to be good for you because it is not planned, and your baby will die, and so let me tell you about the cesarean section. No, your job is to give complete information, and her job is to take decision for herself. Okay, we are going to tell her that okay, yes, the breech vaginal delivery is one of the option for you, because but let me tell you what it is going to be involved. So then you can say the 2 to 3 good things, 2 to 3 bad things. And always remember, when you are explaining, when you are giving your the diagnosis or something or management, always give good the parts first, and then give your the whatever you want to tell her in terms of risk, in terms of the any kind of contraindications or something. So tell them later on. Okay, don't just start your station with the negative vibes. If you will be negative enough, so role player is not going to talk to you. All right. So in 10 minutes time, always remember that your start should be very, the crisp, it should be very good. Don't drag your agenda. Okay. Don't go here and there. Okay. Don't just repeat the question to examiner, or don't just repeat the question to the role player as well. Just look at the, the question and pick up what exactly your task is, why patient is here. For example, the whole summary is given to you that, this lady is this, and, she has had, the scan done, she has had labs done, everything is normal. And today she is here to discuss about the result of the ultrasound. And she seems to be very upset. Okay, now you have your agenda ready that you have to discuss the scan findings, the lab findings, and you have to alleviate her anxiety as well. You have to explore why she is, anxious, why is she, upset about anything. So you are going to start from that. You are not going to repeat the question that, okay, I understand that you are Elizabeth and you are 26 years and you have had, the booking test done, you have had all blood tests done, you have had scan done, and now and everything seems to be normal, and you don't have any medical illness as well, and today you are here. No. Okay, don't drag your agenda too much. All right, you just need to pick the important parts. So, okay, so Elizabeth, I understand that you had been through a couple of investigations or series of investigation, and today you are here to discuss the report. Am I correct? Yes, doctor. Do you have any particular concern to, the discuss in today's consult? Okay, fine. So yes, what I'll be doing is, now you will tell that what you are going to do, what you are going to do for her, what you are going to do, what you are going to explain. So of course, you are going to tell her that, okay, Elizabeth, I'm going to, explain all these investigations to you, and later I'll be giving you that how we are going to manage you in the lines of this, the lab results and all. And in the end, I might, I'm going to give you, the helpful leaflet to read through from NHS if it is, or from the RCOG if it is. So you are going to give that. Okay. So then you are going to come to the treatment option. If there are a couple of management options, so always give management options first. Okay, we have got, the 3 types of management options for you, and you can opt one out of any, the out of 3 for yourself. So I'll be telling you, the all options one by one, and this is how you are going to do. Okay, and plus don't bring fancy sentences, fancy, the kind of and don't try to be so the fancy as well, in terms of that you really want to bring your the best, in terms of that you are using heavy sentences. Okay, you are using jargons, so jargons are not going to be good as well. Your communication should be jargon free, it should be very flowy, it should be natural. Okay, and it should be like this, that you are not thinking and you are not trying to recalling whatever you have the memorized so far. Okay, so 10 minutes time is very crucial, and I'm sure now by now all of you are the kind of well versed with this and well rehearsed as well, that how you are going to utilize. Okay, even just before exam, even if you can finish your station in 11 minutes, 11 and a half, I think it is okay. Okay, don't stress yourself that I can't finish, because exam mode is a very different mode. In exam mode, you can finish your session in 8 minutes, 9 minutes, 10 minutes as well. So don't be upset about that too. If you are in right direction, if you are in right flow, so yes, I mean, you can finish your structured discussion task in 6 minutes to 7, 8 minutes as well. Okay, so don't just be upset about it that yes, this is just the I'm going for exam. Until now, I am finishing my station in like 11 minutes, 12 minutes, so it is okay. Okay, but yes, if it is 15 minutes, 16 minutes, 20 minutes, then it is bad. So that's why it is important that you time yourself now. Whatever number of stations you are practicing in a day, so do try to time yourself. 2 minutes, do try to take your 2 minutes time as well. Although it looks so the overwhelming at that time. Oh yes, I know about this station. So yes, let's start. No, just calm down, calm your nerves. Okay, just think of that how you are going to start, and just think that what if she asks me this, what I'm going to tell? What if she asks me this, what I'm going to tell? Okay, so I think 2 minutes are going to go like this, and 10 minutes are going to be your real exam. Because somewhat, if you are going in right direction, you can finish your session quite early than 10 minutes. If you think that you are fumbling and you are going here and there, and if your the history taking is just like 7 minutes, so then you are going to be in trouble, because after 7 minutes history, you have to break the diagnosis as well, and then you have to do the management too. So make sure that you are rehearsing and you are, doing the sections of your own 10 minutes. Like in 10 minutes time, you are, the giving maximum 4 to 5 minutes for history. It shouldn't be more than that. Okay. Then again, if you think that certain parts doesn't fit in this particular station, so skip them. It's not always mandatory to fulfill your, the pre, the ready template. Okay. So it doesn't matter that if you have missed, things, in the history, but if you think that is important thing which you have missed, you can always come back. When you are talking about blood transfusion, if at all you haven't asked in the history, so you will come back to this. Oh, I'm sorry. Here I want to ask you that do you have any reservation for blood transfusion? No. Okay. Okay. Before I go on and tell you what is going to be the treatment option for you, can I ask that are you allergic to any medication or anything? Okay. If you haven't asked in your history, for example, if we have to tell them management, if it is medical management, then yes, you have to ask about allergy. Okay, and there are the couple of allergies which are very important. Okay, penicillin allergy, metronidazole allergy, then there is paracetamol allergy as well, sulfa drugs allergies. Okay, so these drugs are very much important to the ask about. All right, so make sure that you are the practicing in a way that how you are going to utilize your 10 minutes time, how you are going to time yourself 4 to 5 minutes maximum history. Then your diagnosis should be like in 1 minute or 1.5 minutes. Okay, 1.5. Then your management should be very good. Last 30 seconds or 20 seconds should be left for to closing the loop. Because if it is a referral letter, you have to write back to the GP or the midwife. If at all you have to give patient information leaflet, you have to put her in touch with the counselor, you have to put her in touch with the support group. So yes, you are going to be doing that. Plus you have to inquire again that is there anything you want me to repeat, or is there anything I was not clear about? All right, so make sure that this is very important. And on the other hand, in the end, in the last week, what you have to do is that you have to practice important, you have to you can say shortlist your own stations. You have to make your own list that okay, according to me this is important, according to me this topic is important, so I have to read my guideline, I have to read my talk article, I have to revise my stuff too. So it's a good idea as well that now it is 1 week. So you guys should take, the off from your work. Just stay calm. Just be with you after, the taking good nap, good sleep. The start your studies. Okay. Do practice 4 to 5 stations either in chunks or either in one go. So it will give you a good idea. Then revise yourself. Okay. So the log out from here and there everywhere. Okay. And if at all you have booked any kind of mock with any examiners, so or any the mentor, so it is good. Okay, do go and attempt it. And then again, they don't get the upset that I didn't perform well. Well, it is preparatory mock. So this is going to give you an idea about that how you are going to behave in real exam. All right, clear everyone? Any question? Any question, guys? No question? Or if there is any question from your side for me, if you want to inquire about anything, if you want to know about anything, any station, anywhere. Okay? Yes, very good, very good. Brilliant, Aisha, Nazia, very good. Of course, prayers. My prayers are with you. Hi, Tishni. Good to see you. Okay, okay, very good, very good. So, any question from any module? Okay, if you guys want to ask, if there is any query, anything which is not clear and you really want me to address, or you want to, clarify anything, so please, I'm open for any type of question.
Assalamu alaikum, Dr. Zaib.
Walaikum assalam. How are you, Salma?
Alhamdulillah. How are you?
I'm good, alhamdulillah. I'm good too. Thank you.
Nice to see you after a long time.
Thank you, thank you. Yes, yes, sweetheart. Yes. Any question?
Dr. Zaib, one question that, that last time it came that her mom is ovarian cancer, and she has also BRCA1 and BRCA2 positive. So, so she asks that how long she can wait for this, risk reducing surgery. So she she wants baby also. So according to the TOG article that BRCA1, it is 35 to 40 years she can wait. BRCA2, that 35, 40 to 45 she can wait. So now there is a latest SIPS scientific impact paper. They make it difference. So do you think we can follow this the talk, or
Generally, it is said that 35 years is okay. Okay, generally. So take a general, the rule. So you will always say that it's a good idea that if you complete your family before you turn 35 years, because by the time you are going to be in your 35 plus, so we have to remove, we have to go for this risk reducing surgery. And it is imperative for her if she is BRCA1, BRCA1, BRCA2 mutation as well. So generally 35 years. Don't go in depth of 40, 42. Don't go, just take 35 years as, the kind of cutoff.
Good evening, ma'am. Ma'am, for questions.
actually she's 35 years.
So then
She's
you can say
35
40.
years.
You can go up to 40 if you really want to go.
40.
Yeah.
Okay.
Okay.
Yeah, thank you.
If she is 35 years, then yes, you are not going to go beyond that. And if she can plan her family, so I think she can they start working on that, and by the time she will turn 36, so I think she'll be able to go for the family completion.
Yeah.
Isn't it?
Yeah. Thank you very
Good
much.
thing is
Yeah.
pregnancy of 9
So
months.
another question is that induction. In
Which chart?
Sorry, there is an interruption. Yeah, there is another question. 37 week, 37 week, and she has previous history of cesarean section, but her husband is working in army force, and she came that last time she had a problem because her husband is not with her, so she was suffering a lot. So now she came that her husband is here, so within 2 weeks she wants to deliver, and she wants induction of labor.
Induction is yes, according to TICE guideline, induction is applicable, and this is we call it as the on the basis of I'm forgetting the name especially, but yes, it is applicable. We can go for induction.
37.
Yes, 37 plus
37 weeks we can tell induction.
Yes, we can tell her. Yes, because the term is from 37 to 42.
So do you think we can? So and then we can tell her for sweeping also. We can give her option that after 1 week sweeping, and for to try normally also.
Yes.
Other option.
Yes. So sweeping is first, the type of induction of labor. Sweeping and stretch, and
so sweeping.
Yes.
Yeah. The sweeping we can tell 37, or we have to tell her after 1 week to come. 37 we can do sweeping, or 38.
There is no hard and fast rule. You will say that okay, we can go for the sweep and stretch. It is going to initiate your labor, but before that I have to talk to my consultant, and then we are going to start, because you cannot do anything. So you have to talk to your consultant. You can say that yes, we can think of the going for induction of labor. So we can do this sweep and stretch as the first line or the first mode of the induction of labor, and later we can also call you up for this the proper induction.
Right. Yeah.
With prostaglandins.
Thank you. Yeah. Thank you very much. Thank you.
Okay. Yes. Somebody asked. Yes, Rashmi, do you want to ask any question?
Ma'am, I want to ask for questions in which we cannot make a diagnosis on the spot. Is it okay if we just tell that it could be this, it could be this, and tell just
Yes, absolutely. This is all your right. You are going to be safe. If you don't want to misdiagnose, or if you don't want to give wrong diagnosis, better to talk like this. It can be this, it can be this. So if at all we found out that you are having this problem, so we are going to manage you like this. If we find out that you are going to be having this, so we are going to manage you like. Then again, don't drag into the one only the diagnosis. If you think that you have couple of the things to talk about, so yes, then only you are going to talk in few lines. Okay, few lines. Good part, bad part. Good part, bad part. That's it. Touch and leave. Touch and leave.
Okay. Thank you, ma'am.
Okay. And yes, there can be a couple of stations which we haven't read because somehow, it happens, and it happens to every candidate. There is like, so if you think that, I haven't read this, the topic in the recently or in quite few months. So what you are going to do, you are going to follow the usual template. For example, if it is from urogynecology module, if it is from, the infertility module, it is from, do you think that it is from post-operative care module? So go, the systematically and try to involve role player. Trust me, role players are going to help you. You just need to take their cues. If you are not going to take their cues, then yes, you are going to be in trouble as well. Okay. So even if you don't know anything, so just ask her that, how can I help you today? If you think that, from 2 minutes time, I don't know how am I going to start this session because I have never read this, because I still remember the time when this Charcot-Marie-Tooth disease, that came in the exam. So somehow nobody knew about that. But what, you have to spend your 10 minutes time. So you are going to take the same, your maternal medicine and antenatal care module template into mind. We are going to ask about, can you tell me a little bit more about yourself, when you got diagnosed and what exactly you are, see, you don't know anything about it. So what you have to do, you have to dig out, you have to take the information from patient. And this is what you can do. Now, this is your job, that how effectively you are digging out the information and you are utilizing the same information for yourself later on. So how you are going to go in that scenario as well when you don't know anything about that particular station? So you can say that, okay, so what I'm going to do, this is what we do in maternal medicine or antenatal care, if at all they are here for antenatal checkup, they are here for preconception care or anything. So we are going to involve the respective consultant, your consultant, midwife, support group, and this and that. So start like this. So role player is going to help you in that regard then. Okay. So for me, let me tell you, when I was in exam, somehow I read each and everything, but I left von Willebrand disease, and the von Willebrand disease was in my exam. So this the approach I adopted myself. So it literally helped me. Although I was very upset after that I didn't do well, but somehow I remembered few things from my part 2 study, few things from here and there, and somehow it worked for me. And role player helped me as well for von Willebrand, because von Willebrand is what I knew, this thing that, okay, this is a genetic disease, so I have to ask for partner. I have to ask for that, whether is she in the continuous checkup, whether is she taking any kind of the medications at the moment or no, when was her last checkup. So general rule, follow general rule in that scenario. Don't forget that if in any genetic condition you have to inquire about partner, this is important. You have to inquire about if at all they are on any kind of medications, if at all they are having any consultant input, when was the last checkup, when was the last the investigations done. Because generally, if a patient is a known case of anything, trust me, by the time they will come to us, they are going to be half doctors, because they know their symptoms very well. They know that how to go to the A&E, how to consult, and how to start treatment. Okay. So ask them, inquire them. So be nice in that scenario. Like I was talking to one of my, the good candidate yesterday. So we were like, I mean, okay, we can do acting, and as long as you are a good actor, so I mean, you can do very well in this exam. If you don't know anything, just act like that. Yes, you know, but somehow, you cannot recall properly. So you are just going to get the information from role player. Okay. So act in a way that, I mean, and don't show it from your face that, oh my God, I don't know about this station. How am I going to go about it? No, not at all. Okay. You know the proper, the module from where the question is. So you will start according to that module. Okay. So I understand that you are here today to discuss about this. Can I have a little bit more information about yourself? Can you please tell me in your own words? So she is going to give you the complete information. Now this is your job, that how you are going to use that information for yourself. Okay. Make sure, don't forget to involve the the shared care. Don't forget to involve the respective consultant, your consultant, midwife, if you really want any counselor or something, so involve them. It has to be, at least you will gain the sum of the points. Your safety is going to be covered. Your the couple of things are going to be covered in those you can say the surprise kind of questions. Okay. And secondly, many candidates face a lot of difficulty in doing audit station and in doing risk management station. Okay. So don't be upset. Again, I will say the same. Most of the time they are going to ask you to make the audit either So you need to know the 6 steps of audit properly, and you need to know about the steps of risk management as well. So if you know the steps of risk management, if you know the steps of audit, so I'm sure you can pretty well go about that station. Okay, so because all these type of stations are part of our curriculum, because we don't really practice all these, so somehow we find them the difficult. But if you know the theme, if you know the proper the idea about that topic, so I think you can at least score a few marks. Otherwise it is going to be a clear fail station. Okay, so do try to follow your basic the studies, basic information, whatever and whatever you have the idea about that particular module. All right.
Dr. Zeb, excuse me, there is a
Mhm.
controversy about the examination that online will tell role player for examination or not. Even though, say for example, there is a need or not need. So do you think that we can offer for examination?
If at all you really think that that examination is needed for your management, then yes, you can go for. But otherwise, don't unnecessarily ask her that my nurse will come and a chaperone will come, and then we are going to do the blood pressure and we are going to do this, until and unless you really think that examination is needed for your management, then yes, you have to go.
Okay, right,
And
thank you.
please refrain yourself, all of you guys. Don't say this thing. This is very, the absurd. If somebody say, since we are in online exam, so I cannot examine you, but when I will see you in the real life, I will examine you. Come on, she is sick now, or she'll be sick after like 1 or 2 years as well. So please don't do this mistake either.
Yeah,
This looks very absurd, and this looks, very bad
yeah,
as well. It will show that how
thank
insensitive
you.
you are, right?
Thank you. Dr. Zeb,
Uh-huh.
can you can you give us some tips for the negotiation station? How to deal with negotiation station? Can you give us some tips, please?
Negotiation means when you have to talk about.
Any negotiation station, like patient wants
Uh-huh.
home birth or anything patient
Okay,
wants,
okay,
but
okay.
negotiation.
Let me.
Yeah, please.
Just 1 minute. I have a call from hospital. Just one. Sorry. It actually mentions in exam that this is an online consultation which has become common in COVID time. So I think no need to mention. Of course, yeah. Even in when we were in face-to-face exam, okay. So we never, I myself never tried to unnecessarily say that okay, we have to do the examination, okay, until unless I always say that until unless this examination is really needed for your management, then go for it. Otherwise, I mean, don't unnecessarily waste your precious 1 minute time. Okay. Okay, coming to your home birth, the station. Okay, somehow, the in home birth, they usually bring, the couple of scenarios like that. She's previous scar and she is looking for home birth, or she has had a bad experience in the last delivery, and now that's why she wants to go for home birth. So of course, in that scenario, you can't offer her home birth. This is what we know, that VBAC, I mean, needs to be monitored and everything. So we are not going to give her the option. So how you are going to start that? Yes, okay, Elizabeth, I understand that you want home birth, and which is a very good, the idea, which is a very good option for every woman. There is that you are going to be in your familiar environment, you are going to be with your loved ones. However, in your case, what I can see is that you already had one cesarean section, and I understand that you didn't have a good experience in the last pregnancy. But let me tell you that every pregnancy is different, and in every pregnancy we behave differently as well. In terms of that, you already had one cesarean section, so I'm afraid that we are not going to offer you this home birth, keeping in view that we have to monitor you, we have to monitor your baby, and we have to do continuous monitoring once you are going to be in labor. Plus, if at all any complication happens, because there is a chance, there is a the small risk, there is a small risk that 2 out of 100 women can have a complication of scar rupture, in which the scar is going to give away because of the pain and everything. So if that happens, that is going to be an emergency. And I'm afraid that if that emergency happens, so we have to do emergency measures to save you, because then there is going to be the chance of bleeding, and the midwife cannot handle that emergency alone in the in the home, the setting. On secondly, there can be even if you deliver, there can always be chance of that you bleeding heavily. There can be chances that somehow you can go for there can be chance that your baby may face any kind of problem at that time. So in all these scenarios, this is not going to be very much advisable. However, if you are very much the adamant to go for this, so let me talk to my the consultant, and then he'll be the be able to in good position to talk to you about that. Not even water birth as well, because we have to do continuous monitoring. Okay, even water birth is not the offered in VBAC, because by rule for VBAC we have to offer continuous monitoring. So I mean we shouldn't be the offering anything. Okay, Salma.
Yes, thank you. That to save our time, always better that management plan. If we'll tell, do you think that asking her before that, do you have any expectation for
That's
the
why
management
we
plan?
asked. That's why we
I'll
asked at
ask
the
before,
beginning.
or I'll think that
No. In the when we start our station,
not
don't
this
we
one.
ask that? For every station, we do ask that do you have any
Yeah,
the particular concern to discuss? Okay, before I
yeah,
go on and discuss the management option for you, do you have anything particular to discuss with? Okay,
yeah,
do you have anything particular to the discuss with
yeah. So if she'll
me?
tell yes, I want surgical.
Mhm.
I don't like the medical. So then,
Mhm.
do you think that I'll tell first that there is
No, no,
a
no. You will tell
life?
each and everything. Each and everything you will tell. Okay. Yes, doctor. But I am not, looking for any operation. Yes, yes, I understand, Christy. But this is one of the treatment option as well. I'm just telling you because you have to be aware of all treatment options what there are. Okay. One is with the help of medication. The other is one with the help of operation as well. Right. So yes, you have to do that. Water birth is allowed in previous history of third-degree perineal tear. That depends, that depends. If she is asymptomatic, then yes, maybe plus minus, but in the hospital setting, okay, not in the home birth environment. If it is, she is asymptomatic, then yes, she can go for vaginal delivery and water birth as well, but in the hospital. Okay, because in perineal tear, what we are afraid of recurrence. Okay, what we are afraid of recurrence. That's it. All right. Otherwise, there is no hindrance that she cannot go for, the vaginal delivery again. Okay, good. Any other question? Any other query?
I mean to say that premenstrual syndrome,
Mm-hmm.
like there is so many options. Maybe she was like only the hysterectomy, or she likes that hormonal treatment only. So at that time, I can explain her what she wants, and then I can say that there is other option. Do you want me to explain that? So if she'll
Mm-hmm.
tell that yes, you can explain, or she told no, I don't want to explain any others, then I don't need to explain if she doesn't
No,
like.
of course, of
Is it?
course, of course, of course. You are
Yeah.
going to ask her, and most of the time they do have the certain treatment option for them. Because if she is,
Yeah.
suffering from this condition quite long time, so of course, she is going to tell you that yes, I have this problem, I have this problem. Okay.
Yeah.
Hmm.
Yes. Thank you very much.
Okay, very good. Any other question? Nazia, Alisa, Aisha, Teshni. Any question, guys? Anam, Hindu, Mariam, Nusrat, Nurjahan, all of you guys. Okay, okay, great. I will pray for you, definitely, definitely. In fact, I know this is very stressful time. Inshallah, everything will be good. All you guys need to do is just stay focused, stay calm, and utilize your time properly. Utilize your time properly. Okay. 2 minutes time for me, even as an exam candidate, even as an examiner, even as a the teacher as well now, I really think 2 minutes time is very much important, because if you are not getting the theme from the 2 minute time, that what exactly the exam is all about, okay, so how you are going to do, okay, how you are going to go about that station. All right. Secondly, your tone should be very, the kind of subtle, your expression should be very subtle. Okay. Pace is also very much important. Don't, please, another thing, don't just bombard the information like we have been discussing now, that if we have got a couple of management options, so give one management option and then ask, am I clear so far? Okay. Okay, let me take you through the another treatment option. So you will tell the few things, two, the one good thing, one bad part, and then you are going to go about. Okay, so don't just the quickly go, like, I mean, tell her, and you are not the involving her. Involvement is very necessary. It should be a two-way, the kind of communication. It should not be one way, that you are just bombarding her and you are just the kind of the giving her all information in one go. Okay, give information in chunk, and the ask about that, how you are going to the go about that information. Okay. Thank you, Mera, thank you so much. Thank you, Shaista. Still, if there is any query, I'm here. Okay, anybody, if you want to ask anything about any station. Okay, one more thing quickly before I the sign off. So about the lists, the operation theater list, it is very much important that you understand that what exactly the list is all about, how many patients are with you. So for example, the discussion time is 10 minutes and you took 1 minute to read that, which is very the likely and which is very normal, you can take that. Okay, and in 9 minutes time you have to discuss 4 cases. So plan in your mind that in 10 minutes time I have to discuss, 9 minutes time I have to discuss 4 cases. So roughly I'm going to give 1.5 minute or 2 minutes to each case. Okay, so don't just the kind of spend unnecessary time in one case, so because you have to discuss the 4 cases with the examiner. Okay, and make sure it will be written, as well, that you have to discuss the risk and associated with particular surgery, and you have to tell that how you are going to mitigate those risks, or how you are going to avoid those risks. So make sure that you are just the around those particular things. What are the risks, how you are going to minimize this risk? What is the complication, how you are going to prevent it? What is the risk factor, how you are going to optimize the patient's health before she goes for the cesarean or for any kind of list. And another thing, on the list there can be their question which can be postponed, which can be delayed. All right, but justify it. If you think that this looks like a the not an emergency and it can be done electively, because you need the further information for this patient, you need the further the kind of investigations for this patient, you need another the input from MDT or whatever. Okay, so you can say that in my opinion we can even postpone this case as well. So you can say, but remember, you have to justify. Again, for everything you need to justify, and justify. Okay, for example, you want to ask for any kind of the this full blood count. Why you want to go for full blood count? You have to justify. Why you want to go for urine MSU? You have to justify. Why you want the MRI or MRV or any the special investigation for patient? You have to justify that. Okay, because if you are the explaining the same to the role player or patient, at the same time examiner is also observing. Okay, examiner is going to take the your marks at the same time. All right, so make sure that you are justifying, plus same in the structured discussion as well. If you want to ask anything, because couple of questions are going to be, take me through the history, take me through the management plan, okay, or take me through that how you are going to counsel this woman. All right. So if in structured discussion, examiner is asking you that take me through how you are going to counsel the woman with regard to this particular diagnosis. So make sure that you are, because he wants to know now that how you are going to, the counsel the woman. So make sure that you are counseling in layman language. Okay, in that scenario. Surgical management of 3rd and 4th degree prolapse like uterine rectocele. I'm sorry, I didn't get your question. Whatever the management is, this is not your domain. You can just only tell her that okay, this can be the option. Then you have to involve your urogynecologist or any senior, okay, any consultant, in not in this particular surgery, but in all cases where you need the further the management. Okay, so it's not going to be directly that they really want that okay, you are urogynecologist and you just have to give the complete the treatment option. Okay. So 3rd, 4th degree prolapse, like if it is uterine UV prolapse, uterovaginal prolapse, then yes, you can talk about the hysterectomy along with the rectocele. If it is rectocele, then yes, you are going to involve the you are going to go for posterior repair as well. Rectocele, which degree rectocele? 1st degree, 2nd degree, then no need. Okay, only the exercises are going to be enough. If it is advanced, then yes, you have to go for other thing. But make sure that you are just giving your the idea that what type of treatment can be offered in such scenario. But yes, the final decision is going to be done by the urogynecologist or the consultant. Okay. Any other question, guys? Yes, you can offer. Yes, you can offer vaginal hysterectomy. Yes, you can offer. Like we can go for the removal of uterus through the vaginal route, since it is already prolapsed outside, so that is going to be easy. But again, final decision will be by the consultant. Say that at least. Even if you know that this is the perfect the treatment, or you are very much sure about your answer, but don't forget to involve your consultant. Okay. Good. Any other question, guys?
Okay. In case of angry husband who's coming to us after UAE, if a patient is in ICU and it is written in the scenario that debrief the husband, as in patient has already given the permission. So in that case, if husband is not knowing about the hysterectomy, should we discuss about the hysterectomy, or should we take first history from the husband, what he knows? What should be our strategy in that case?
Sweetheart, I know this is an exam scenario, and everybody, whoever comes after exam, gives a very different, the scenario. As far as I know, because this is a kind of 2017 station, okay? Since 2017, it is coming on and off. So, the particular scenario, what I know is that, his wife is in, the ICU or the recovery, and you don't have any notes because you as a doctor, were assisting your consultant in the operation, and now you are here to debrief him. Okay. I got your question that you want to ask about the confidentiality, maybe, but I think there is no confidentiality trap. For example, if I am the husband and my wife is in ICU, and I know that what she had been through. Okay, she has had the previous operation, and then she was unwell for quite few days, and now again I brought her to the hospital. So do you think there is any kind of confidentiality? For me, until and unless it is going to be written clearly that that he doesn't know, or that he doesn't want to know, but he just wants to know about the the well-being of his wife. So in that scenario, maybe. But then my question to you is, Shaheen, that how you are going to go in 10 minutes time? You are just going to say, sorry, your wife is in ICU. Sorry, she is here. Sorry, she is in West Bank. What you will do in 10 minutes time?
So we should take the history from the husband, that what he knows about the patient.
Simply, you can simply ask that. Okay, I understand that that from the case notes that your wife has had an operation a few weeks ago. Am I right? Yes. So I'm sorry, I don't want to bring back those bad memories again. But can you please just tell me that how was she after that operation, and how was she coping after that? Was she the unwell for a few days or what? See, you are giving him hints as well. Okay, you are asking him that he is going to take you through the complete process, that after that UAE, she has had the kind of what whatever. So he is going to tell you. Then you are going to it means that you are making a scenario now. Okay, now you are going to the break the bomb that okay, we have done the hysterectomy. Okay, then of course he'll be angry. Then of course he will be showing some kind of anger towards you, plus the upset as well. So now this is going to be your station for communication, how you calm him down, how you tell him that that this is going to be done. On the other hand, confidentiality, which I believe is very unlikely in this particular station, until and unless if it is the somewhat any kind of for example, it is not the same case, but we have discussed the investigation. So maybe in that scenario it can be confidentiality, but in this I think it is very unlikely.
Okay. Okay. Thank you.
Hmm.
Because
Okay.
nowadays RCOG is twisting so much.
I
So I don't
know, I
know
know.
what
That's
they
what
will do.
I know. That's what I'm saying. Every time a student comes after the exam, they give another, the very strange and very different, the story of the same station.
Yeah.
So that's what I'm saying, that, yes, of course, so we need to know about the confidentiality as well from our end, that what are the rules of confidentiality, how we are going to, because this way or that way, we have to, we don't have to break the confidentiality, right, by rule. So if at all, it is about something big, but in this particular scenario, then I'm afraid that what we are going to talk in 10 minutes time.
Okay.
So it is
Okay.
going to be a little difficult then. Yes.
Okay. Thank you.
Excuse me,
Okay.
Dr. Zaib.
Ji.
This station I know.
Mm-hmm.
Dr. Zaib,
Yes,
excuse
yes,
me. This
yes, yes.
station was it was with me last time.
Mm-hmm.
Yeah, the
Yes, how was it?
husband, he told that
Mm-hmm.
yeah, the last night they called me and they told that they're taking my wife, but I don't know that what operation done, what is done. So can you
Mm-hmm.
tell me? So he
Mm-hmm.
doesn't know actually. Only
Mm-hmm.
they informed him that we are taking your wife in the theater.
Mm-hmm.
That's it.
Mm-hmm. 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 So what was this according to you? That you have to tell him that, I mean, you have done hysterectomy, isn't it?
But according to the rule, we shouldn't say anything to the husband, isn't it? According to the rule.
Which rule?
What do you think? That confidentiality, you have to maintain the
Which
confidentiality
confidentiality?
that he
This
stick
is
to
his
me.
wife. That this is his wife, isn't it? And he was
Even though
aware of
wife,
each and
here
every.
it is the here they don't like to tell anything that without
Okay,
permission.
okay, fine. So can you please tell me what was your task
Huh?
in
Tax is
this
that he
scenario?
came to know that this same scenario. And he told that there is a what is this, that they are on IVF treatment. Okay, they are in IVF treatment, and then after that they are in third circle or second circle in IVF treatment.
Mm-hmm.
Then they got this fibroid in
Mm-hmm.
the uterus. Then after that they told that this big fibroid need to do that uterine embolization.
Mm-hmm.
After that it done, he
Okay.
told this history, all history,
Mhm.
you know.
All right, all right. So I
Yeah,
want to know that if it was your station, so I want to know what was your task. That your task was just to meet the husband. That's it, and talk about what? Explain the diagnosis. Explain what exactly has happened to his wife, or the what? What was your task? Because that is the exam question.
yeah, he wants to know that what happened my wife, why she's
Mm-hmm.
in. So we can say that, no, this is my opinion. I told him that, about the hysterectomy, that that we don't have any way rather than
Mm-hmm.
to save her life. We have to do
Mm-hmm.
that because it was emergency situation
Mm-hmm.
when she
Mm-hmm.
came. So this I told, but I'm thinking that we can tell that, you know, this is when your wife will be stable. Now she's in a good hand. We are taking care of your wife, and in high dependency unit, special care unit, and everybody is taking. When she will be fine, we'll talk together, and in front of your wife, we'll talk together. We'll inform you, but we can reassure him that everything is
Okay.
her wife is
So when
okay.
you did reassurance, so was he okay?
No, role player was okay with me. You know, you cannot understand, even though they are quiet, maybe they will fail you, but you cannot understand. Sometimes they are angry, sometimes they will be quiet also. But he was okay with me. But I'm thinking that I told him that already hysterectomy done. I explained to him that, you know, it was life-threatening condition. So I'm thinking that it is confidentiality that I shouldn't open that, because I told him, what do you know? Do you know that anything? Do you have any idea what happened? Then he told, no. Last night only, when they are taking her in operation theater, at the time they inform me that we are taking your wife. I don't know anything.
Very
What he
bizarre
told.
scenario. In fact, you know, even if he got a call that, you know, the taking wife, so it is very unlikely that husband will not ask that
No,
why are you
no,
taking my
only
wife to the.
telephone.
I know, telephone,
Telephone
even
call.
on the telephone,
No, he
even on the
doesn't know.
telephone call.
He told, he doesn't know.
I have to ask a few other candidates
I
again
asked him
because I
that,
need to know the
do you
task.
know?
Okay, I need to know the task exactly. What was the task? Because if at all we have to just in 10 minutes we just have to say the same thing again and again, that please let me reassure you that she is in best hands and, you know, we are taking best care of her. So I think in 10 minutes time we just need to say the same again and again. I don't know. According to me, which is very unreal, and according to me, this is not even, you know, the practical as well. So at least we have to say no. We
But
can't.
this is,
So until unless it is written in the task that, you know, that his wife didn't want his husband to know about the treatment. So in that scenario, yes, we will keep the confidentiality. If there is nothing like sort of, then I think what we are going to do in 10 minutes, that's why I need to know the task. What was exactly the task? Because that is going to determine that, you know, how we are going to go about this session. But, you know, in 10 minutes, it is very unlikely that we just have to talk about that. Sorry, this has happened. She's in best hands and blah, blah, blah.
no, not my question
Dr.
is
Zaib,
not
may I speak?
that.
May
If
I
there
add
is
on to the scenario?
confidentiality issue, then they will fail me.
Yes, my wish.
This also came into my exam, and the scenario was that the same scenario was there. The husband was very anxious, very worried that we came last night and nobody's telling me about the patient. And it was exactly same scenario as she's telling that you were in the operation theater and with that. So I told him. I first asked him, what happened to your wife? He told me everything. He said that we undergone a procedure. Had a big fibroid pregnancy last 5 years. And then I told him that yes, when your wife was brought here, she was very sick. She had infection, and we were taken her to the operation theater. And very sadly to tell you that there was the spread. Her all of the womb was infected, so that's why we had to take it out as a life saving. So he was okay with that. I don't think so. You are very right. I was also thinking after the exam that what should
Exactly.
he was asking, even he asked me later on, okay, so now my wife
My
does not have
options.
womb, what are our
My
pregnancy
options. Yes, I know the situation very well. And that's what I'm telling you guys is that every
No,
time
same I
students
told
will come,
also.
so it is okay, which I think is okay. There is no confidentiality trap according to me. Okay.
Surrogacy, even though I told surrogacy,
Yes,
he wants to
yes.
know
In
other
the end,
option. I told surrogacy also.
yes. In the end, you can you can talk about, you know, the other options as well, which is quite okay. Okay, which is not bad as well. But my concern is that what we are going to do in 10 minutes time. There must be any task, okay? There must be something that we have to counsel. So what this station is all about? This station is all about debrief. This station is all about your communication skills. This station is all about how you are going to calm down an angry husband, okay? Which I believe is correct, okay? Otherwise, if we just have to keep the confidentiality, then what we are going to do in 10 minutes? Child sexual abuse, mother not ready to give history of or admission, how to sensitively convince. This is the sensitively convince. You have to the talk to her that we need to examine your the girl thoroughly. We need to examine your daughter thoroughly. Plus, always remember, in this scenario there is going to be a kind of the other siblings involvement as well, other the kind of this as well. So you have to convince in a way that you are going to say that this is going to be in the the best interest of your the daughter, that we have to admit her, we have to do certain tests on her, we have to make sure that the she is not having any other the kind of injury or anything. Okay, plus we are going to take help from the other the our the teams as well. So the baby is going to be admitted in the pediatric the gynecology unit. So, this is going to be a good idea. Okay. So this is what you can say, because this is structured discussion, and examiner will ask you that, her mother is not willing to admit the child. So how you are going to convince? So you are going to say that, I'm going to talk about that, this really needs the urgent attention. This really needs thorough investigation, plus examination as well, plus involvement of the forensic experts, involvement of the pediatric gynecologist, involvement of the the virologist as well, because you have to start antiviral treatment because she has developed herpes infection, isn't it? So in that scenario, you will say that, okay, if she is hesitant, then I have to look for some other possibilities, that the maybe her mother knows that who has done this assault, or maybe the other siblings are at risk of development of the same. So we have to ensure the safety. Safety is going to be paramount in this condition, for the siblings, for this child as well, for the mother as well. So this is how I'm going to convince. Okay, Aisha? Because in structured discussion, examiner wants to know that how you are going to, do you really know that how you are going to talk about? Yes.
Dr. Zaib? Actually, in this scenario, in the scenario, it was mentioned that mother is uninterested and was lying on the couch. This is what the examiner pointed out later, and he asked me, "What will you do about that?" So, what should be the answer in your?
Uninterested means, it means that that you have to explore that whether she is also a victim of the same abuse or no. Is she is also having any kind of the problem in terms of behavioral issue, any kind of psychological issue as well. So I might need to evaluate the her condition too. So I will just tell her that we might need to the involve other agencies in your care, because then it can be, if she is uninterested, so there is possible likelihood of that she knows that who is the the perpetrator, isn't it? So because that was a the relatively very young girl, 9 years. So yes, maybe she knows about the the person who has done this molestation or whatever exploitation.
Dr. Zaib, excuse me, in this case, do you think we can tell that we want to know that she has period or not? If there is a possibility, we may offer her for pregnancy test or HIV prophylaxis, take swab for the sexually transmitted infection. And
yes, if at all, you can say that I will try to rule out the possibility of precocious puberty as well. So I will inquire about that, whether has she had any kind of periods or no. So I will take this possibility in my mind. So yes, you can ask, justify,
and HIV
whatever you
prophylaxis,
want.
hepatitis B vaccine. Do you think?
Yes. That is going to be your sexual assault. The the complete referral. Okay, very good. Any other question?
Dr. Zaid, there was another scenario that the patient was 9 weeks postnatal, and she had evacuation after that, and she was 3 weeks postnatal post evacuation. And then they asked, the patient was here with a histopathology report, and all I remember about the histopathology report is there was some dimensions measured, maybe 2 to 3 millimeters or centimeters, and it was maybe lump of fat, and it was gray color as well. And there was no mention of any vesicles, anything that give me an idea that it's trophoblastic something. So the question was, tell us, discuss this histopathology report with the patient, answer her concerns, and how would you manage this case? So what was that scenario all about?
Was
that
what?
diagnosis?
Sorry, the size of the was 2 into 3 centimeter, and it was
Maybe,
fatty.
yes, I don't remember exactly, but maybe it was 2 into 3 centimeter, or maybe it was 3 into 4 centimeter, but like this. And the only thing they mentioned was, it was the word I remember from my exam is, it was a fat something. They said it was a fat. And other thing I remember is that it was on the fundal part. And I also remember a word gray as well, that it was maybe some gray color. And it was that you discuss this report with the patient, and you answer her concerns and discuss the management options. So I had no idea what to discuss with the patient at that time. So was it a gestation trophoblastic neoplasia, or was it some kind of perforation?
The fat is not going to be with the GTN, right? For GTN, you have to have persistent trophoblastic, the villi, or you may have, some kind of anchoring villi, okay, anchoring villi, some kind of terminologies in the histopathology. Otherwise, the fatty vacuoles or present in the gray color, that doesn't show any kind of. If it was gray color, then my mind is going towards necrosis as well. My mind is going towards chronic endometritis as well. Okay, there can be so many things. Okay, Aisha has written that was a case of uterine perforation, mental fat cells in histopathology. Okay, yes, that is possibility, because otherwise there is no, the kind of possibility of having fat in uterus, isn't it? There is no possibility.
And yes, the patient was also asking that, is it a cancer? This is a question I remember.
If she was asking the cancer, then maybe it can be. If it was written that anchoring villi or trophoblastic villi, or the vacuoles, okay, having vacuoles and the with anchoring villi, then maybe it can be GTN. Okay, then it can be GTN. Then it can be the anything.
Dr. Zaib, I remember it very well, because I read this report again and again in order to look for whether there are any medicals. But one of my friends, she remembered that it was mentioned before that this patient has been called urgently. So she took it as an emergency and took it as a GTN, and she took it that way. I missed that part of reading. I immediately moved on to the histopathology report, and I was reading again and again to find out what is it, and I was clueless till the went on, and I had to narrow it. It was and the first line was about the gray color, and the dimensions, and then the third part it was written some fat. It was written some fat and no vesicles at all. Because even the patient asked me what is this.
Again,
so
the fat is very unlikely.
And I said, but to tell this patient what is this fat?
Fat is very unlikely, sweetheart, in uterus. Okay, fat is very unlikely. I mean, this is very unlikely that we will see fat in uterus. But somehow, if it was a kind of perforation, then maybe omental fat cells can be there. Okay, maybe it was a necrotic kind of area, that it was a gray, and in that scenario, yes, we can get the same idea, isn't it? So I mean, this is what I can say. But yes, if you remember the complete case, can you please send it to me on my Telegram or WhatsApp or wherever? So I will try to look into this, and I will write my answer in your the MRCOG Part 3 guide too. Okay, so it will be clear for everyone, and I will try to do it as quickly as possible.
Okay, thank you, Dr.
Okay.
Excuse me, Dr. Zaib, this is actually, it was after cesarean section.
Okay.
After cesarean section, then re-evacuation done.
Right?
Yeah, postnatal. So after cesarean section, there is a written product. Okay, there is a something. So they have done re-operation. That means evacuation done. Then she has no problem at all, no complaint. So she was called for this to know the report only.
See, I have just gone through the internet, and they are also showing that there will be some kind of extravillous
I'm telling you the report.
There will be anchoring villi. There will be something. Okay.
Yeah, no, there is a what is written. I'm telling you, there is a written topoplastic tissue, topoblast. There is a topoblast. There is a adipose tissue. There is a
Yes.
necrotic tissue, necrosis
Necrotic.
also.
Necrosis. Yes.
Necrosis.
Gray can be
Necrosis.
necrosis. Yes.
Yeah, necrosis, adipose tissue, and topoblast.
Yes. Then it is
And
molar. Then it is GTN.
GTN, but adipose tissue, from where it will come? So some they mention
Perforation.
as a perforation, some they mention as gestational trophoblastic disease. You know, so yeah, so that's why there is a
Okay,
controversy.
even if it was that, they don't go about the report, ask the the symptoms. Okay. Okay, Aisha, let me tell you that even
No
if it was
symptoms.
missed,
She
so you
don't
are
have
going
any
to
symptoms.
ask, you are going to ask about the normal post, the operative checks. You are going to ask about, the general well-being, temperature, any, the having, the getting cold
Nothing.
and getting, the fever at all times, abdominal pain.
Yeah.
Any vaginal bleeding,
No.
any unusual vaginal discharge, smelly bleeding, smelly discharge, okay,
Nothing.
and tenderness in the lower abdomen. So it will give you an idea that whether it was a kind of the perforation or sepsis issue going into. Then yes, if usually if it is very small, the kind of perforation, it can get healed on itself. Okay, so you are just going to inquire about.
Yeah.
And the report, yes, the report, if it was the perforation, so it can be a perforation admixed with the GTN. Yes, you in the management, then you will say that okay, I would like to send the serum beta HCG as well now. Okay, in the management you can say, if you feel that okay it is GTN, so yes, you will send the beta HCG. You will refer her to the the regional trophoblastic centers as well. Plus you will refer to the the, all these specialists. So this is your job. You don't have to manage.
Yeah.
You are just going to they put her in touch with the specialist. That's it.
Yeah, but role player is asking should only to know diagnosis. She told what is this? What is this? Then after that I was confused also. So I told there is there could be after birth things, because there is a topoplastic I saw. Then there is I told necrotic tissue. This one also I explained. Then I told that adipose tissue I didn't tell any perforation. So I told it could be different. It is difficult to tell you exactly what it is. So I'll inform my consultant as soon as possible.
Exactly.
I'll
Stay
discuss
safe.
now.
Stay safe.
But
Yes,
she
yes,
wants to
yes.
know the diagnosis.
Of course. Then if it is GTN, if it was clearly written, then yes, you will go with the diagnosis of GTN. You will tell her that yes, this is yes, complication of and this can happen, although this is very rare, and 1 in 100,000 or 200,000 women can develop this, and I'm so sorry, unfortunately you are one of those. But now onwards we have to manage you, and I have to refer you to the gestational trophoblastic center. You have to be vigilant for few things. You are going to tell her red flag signs. You are going to tell her that from now onwards we are going to to monitor you in terms of the beta HCG, pregnancy hormone, and for until your follow-up is complete, until everything is clear out, then you have to do the suitable contraception in the form of condoms, and that's it. This is what you are going to do. You are not going to do anything. If it is GTN, clearly say GTN.
Yeah.
Don't go here and there. Yes.
Or also from cesarean section, it could be small perforation also.
Small
from cesarean
perforation,
section, it can
yes.
come.
Yes, small
Yeah.
perforation, and even
Because
if
it is
post,
after cesarean section, if they will do evacuation, there is a risk of perforation also, isn't it? So from that point, the adipose tissue can come.
Yes, adipose tissues can come. It can be the undiagnosed perforation as well. So you will be open and honest. You can say that it can be because of that, but at the moment you are not having any kind of complaints, but still I will put you in touch with my consultant. So it's better. It's better to be safe.
Yeah. Yes. Yeah. Thank you.
Okay. Very good. Aisha, clear? Okay. Very good. Very good. Okay, guys. So wish you all the best, all of you, and you all are ready, prepared for this exam. Just stay confident, stay focused, and try to follow whatever I have, they try to convey my message, that you just need to stay calm. Okay, you just need to be yourself, and plus, the one more thing, just be yourself. All right, Be yourself. You don't have to imitate anything. You don't have to lie. You don't have to do anything, which you haven't done before. Okay. You just need to be yourself. Stay, the composed, and stay, the confident. And don't try to bring, like I said earlier, fancy sentences in your, the conversation. You just need to be okay, whatever it is. This is not your English language exam at all. Okay. This is just communication skills. The examiner or the role player, they just want to know that if at all you work in NHS, how you are going to behave, how you are going to communicate. And rest, of course, once you are going to go for your GMC, then yes, you have to pass your English language test as well, but not now. As if now you just need to master on that how you are going to utilize your 2 minutes and utilize your 10 minutes. Don't go into the depth of each and everything. Okay. Just stay, the superficial, stay confident, be yourself. That's it. Okay. And inshallah everything will go good, and you just need to be confident and be good to yourself as well, be easy on yourself as well. Okay guys, thank you so much for being here. Thank you so much for being patient and listening to me. Still, if you guys have any query, anything, so you guys can write to me on the MRCOG Part 3 guide group, okay, on Facebook, on Telegram, or even do get in touch with me in person as well. Okay, I'm always there. So inshallah, I will try to see you guys some other time. Okay, right? So all the very best, guys. Stay focused and stay motivated. Bye bye. All the very best, all of you. Thank you.
Thank you very much, Dr. Zaib. Assalamu alaikum.
Walaikum salam.